Corporate Accountability and Public Participation Africa, CAPPA, is advocating for the urgent regulation of bouillon cubes, commonly known as seasoning, due to the concerns about their high salt and sodium content, which pose significant public health risks in Nigeria. CAPPA's Executive Director, Mr. Akinbode Oluwafemi, at a media briefing in Abuja, stressed the need for the government to review existing policies and establish a regulatory framework to ensure that manufacturing industries are accountable for the levels of consumption within the nation. Mr. Oluwafemi linked the rise in cardiovascular diseases to excessive fortified salt intake, underlining the importance of regulating these products to protect public health.
If you are watching the health statistics in Nigeria today, there is an upsurge of non-communicable diseases. There is the slump attack upsurge. People slump and die. Rising cases of hypertension and the rest of them. And we think that there should be a good vehicle than a vehicle that will lead Nigerians to be consuming more sodium, which bouillon van represents.
Also speaking to newsmen, CAPPA Program Officer of Cardiovascular Health, Mrs. Bukoka Olukemi Odele, assures that the organization will engage government to foster implementation of adverts and marketing restrictions for public high-sodium foods.
We are advocating for the implementation of front-of-pack warning labels. In developed countries, when you buy foods, apart from the nutrient fact information behind the pack, we have a warning logo that shows you that this food is high in salt, it is high in sodium, and that helps consumers to make better informed decisions. So when you see that, oh, this food is high in sodium or salt and it's capable of giving you hypertension or cardiovascular disease, you wouldn't pick it from the shelf. If you pick it, you're picking it at your own peril. So
Director, Health, Equity and Development, Dr. Jerome Mafeni, who spoke on their nutritional values, said they are just mere flavors without additional health benefits, adding that people were eating healthy prior to advent of the bouillon cubes.
Well, there was a time when there were no bouillon cubes in the market. Nigeria didn't always have bouillon cubes. The people in the rural communities didn't always grow up knowing that bouillon cubes existed. So that they were introduced and people got hooked on them does not mean that people cannot, if they recognize the dangers to their health, not reverse. The bouillon cube flavors, whether it's meat flavor or chicken flavor or fish flavor, whatever flavor it is that they've added to those bouillon cubes, are exactly what you said. They are just flavors, right? And they do not confer any health benefits. Our rural women had known in the past how to cook meals without using any of these seasonings or any of these artificial flavors.
The organization is also advocating for collaboration among relevant agencies on ensuring food fortification meet all WHO criteria.